Hello, I'm here from Cardiac Science to present the training video on the PowerHeart G5 automated external defibrillator. The G5 has been designed to be extremely reliable and easy to use, so anyone who witnesses a cardiac arrest has the confidence to grab the defibrillator and use it appropriately. The G5 will guide you through the whole rescue process. Once the lid is open, voice and text prompts will guide you through how to effectively place the electrodes on the patient's bare chest. Once effectively placed, the AED will analyse the patient's heart rhythm and determine if a shock is required. 5. Now let's deal with the problem of sudden cardiac arrest. Sudden cardiac arrest is an electrical malfunction of your heart muscle. The function of your heart is to pump blood to your vital organs, and when you suffer a cardiac arrest, your heart muscle starts to quiver and therefore the blood doesn't get to your vital organs. Signs of sudden cardiac arrest are the patient is unconscious, not breathing and unresponsive. Sudden cardiac arrest is different to a heart attack. A heart attack is a mechanical problem which is caused by a blockage of arteries to the heart muscle. In order to survive a sudden cardiac arrest, defibrillation is required. Defibrillation is a controlled pulse of energy to the heart muscle to convert it from that abnormal state of quivering back to a normal state. The G5 customises the energy to suit the patient. Defibrillation is the only definitive treatment for sudden cardiac arrest. CPR alone cannot correct an abnormal heart rhythm. In fact, CPR is used in conjunction with defibrillation for a sudden cardiac arrest patient. The chain of survival has been established for many years and represents a chain of actions that, if implemented immediately, when a sudden cardiac arrest victim collapses, can lead to a greater opportunity for survival. The basic life support guidelines released by the Australian Resuscitation Council includes defibrillation. D. Check for dangers. R. Check for response of the patient. S. Send for help, call 000. A. Open the airway of the patient. B. Check if the patient is breathing normally. C. Commence CPR, 30 compressions followed by 2 breaths. D. If available, attach defibrillator. To use the G5 AED is extremely easy. Opening the lid turns the device on. Voice and text prompts guide you through exactly what to do. And at the end of the day, all you're doing is placing the electrodes on the patient's bare chest. One on the upper chest, under the collarbone on the right side, and the other on the left side under the rib cage. The AED knows the speed of the user. Once you've peeled one electrode, it will only then proceed to the next prompt. However, if you know what you're doing and place the electrodes on the patient's bare chest, it will cut out all the prompts and go straight to analysing the heart rhythm. Once the electrodes have been effectively placed, the AED will analyse the patient's heart rhythm and determine if the patient is suffering a cardiac arrest. Only if they're suffering a cardiac arrest will the AED advise to deliver a shock. You cannot inappropriately use the G5. It will only shock if a person is suffering a cardiac arrest or alternatively talk you through CPR. If a shock is required, a compulsory 2 minutes of CPR will follow. Using the G5 AED is extremely easy. All you need to do is open the lid to turn the device on. Voice prompts will guide you through the rescue.
Stay calm. Follow these instructions. Make sure 000 is cooled now. Begin by exposing patient's bare chest. Remove or cut clothing if needed. When patient's chest is bare, remove the white square package from lid of AED. Tear open the white package across dotted line and remove pads. Peel one of the white pads completely from blue plastic. Begin pulling from the tabbed corner. Firmly place the pad without the blue plastic on patient's bare chest, exactly as shown on pads. This pad can be placed on either of the 2 locations as shown on pads. Firmly place the second pad on the other location exactly as shown on pads. Do not touch the patient. Analysing heart rhythm. Please wait. Shock advised. Do not touch the patient. Shock will be delivered in 3, 2, 1. Shock delivered. It is now safe to touch the patient.
The AED will still guide you through how to perform CPR along with the metronome for 30 compressions as well as the 2 breaths. The only difference is that the AED will not give you feedback during CPR. Once the CPR cycle is complete, the G5 analyses the heart rhythm and delivers additional therapy if necessary. Leave the electrode pads on the patient until the ambulance arrives.